In this lecture, we will discuss the upper limb pathology, that is lateral epicondylitis, also known as tennis elbow. In the lateral epicondylitis, there is inflammation of the extensor muscles. It is most common overuse syndrome in the elbow. Lateral epicondylitis or tennis elbow is an injury involving the extensor muscle of the forearm. It also involves supinatus. These muscles originate on the lateral epicondyle region of the distal end of the humerus. So, when the inflammation of these muscles occur, we can call it lateral epicondylitis. The clinical examination of lateral epicondylitis is often clear. It is shown with local tenderness. There is a tenderness over the common forearm extensor tendon insertion at the lateral epicondyle. There is a tenderness. This can be extended to the extensor mass with less annular ligament. Pain can be produced with resisted wrist and middle finger extension with the gripping activities. We can use it for as a test. It is possible that symptoms are generated by passive wrist flexion with elbow extension. This is also used in our special test. We can diagnose it with these two conditions. We can ever use the resisted position. We can also go for passive wrist flexion and elbow extension to diagnose the lateral epicondylitis. It is often seen that the flexibility and the strength in the wrist extensors and posterior muscle shoulder muscles are deficient. There is a low strength in these muscles. The treatment for tennis elbow is ultrasound. Ultrasonic therapy is very useful for this, and the TENS we can use for 20 minutes. These two things can improve the patient condition and reduce his pain. Cerex physiotherapy. It is very common intervention that combine the use of the deep transverse friction with manipulation, which was used with success by Cerex and Cerex for treatment lateral epicondylitis. These techniques is very common used in this condition. This is the lateral epicondyle, the tendon, their origins. This is condition is called tennis elbow. If there is inflammation in this tear in the tendon, you can see in the picture. Contraindications of this technique, Cerex technique, are active infection, bursitis if there is inflammation in the bursa, disorders of the nerve structures, ossification and calcification of the soft tissues, and if there is any acute rheumatoid arthritis or any inflammation of the joints. In these conditions are contraindication, you cannot go for Cerex physiotherapy. Deep transverse friction massage. Patient elbow is bolted in a 90-degree flexion, fully supinated position, forearm in supination. Deep transverse friction massage is applied with the thumb at the common extensor tendons just anterior to the epicondyle. Friction was applied for 10 minutes prior to the Mills manipulation. We can go for friction. Deep transverse friction massage. This is the massage condition. For this, to apply this massage techniques, the patient symptoms improve, and it can apply before the Mills manipulation. And after this massage technique, we can go for Mills manipulation. Here you can see the picture. This is the position starting, and this is the position that we can go for manipulation. Patient in the sitting with arm in the abduction, you can see an internally rotation such as the chromium face upward. This you can see chromium face upward, forearm fully pronated and wrist in the flexion. Wrist in the flexion. Therapist one hand hold the wrist flexion, the other hand placed over the olecranon. You can see one hand here, one hand placed on the wrist flexion. Maintaining this position, the therapist apply a high velocity, low amplitude thrust through the olecranon. This is the manipulation technique we can use for lateral epicondylitis. In lateral epicondylitis, which group of muscles involve? Can you answer me in the comment? Thank you.